Good afternoon. My name is Ethan Turner, and today I'm going to be presenting why the Canadian healthcare system should not introduce a private health sector. Introducing privatization in the Canadian healthcare system may actually worsen its current state rather than improving it. When we look closely at potential consequences, several concerns become clear. First, privatization could pull essential resources such as funding, staff, and medical expertise. It also risks creating a two-tier system, where those who can afford to pay receive faster and better care. Lastly, instead of improving wait times, privatization could make them worse for people who depend on the public system, as resources would be stretched even thinner. Canada already faces significant shortages in doctors, nurses, and essential medical resources. Our public healthcare system is under pressure, and staffing levels are struggling to keep up with demand. Introducing privatization can make this situation worse. Private clinics offer better pay, working conditions, and less stressful workload, which gives a lot of incentive to leave the public system. On top of that, the healthcare workforce is aging rapidly. Many experienced workers are retiring, while few new recruits are joining. Staffing shortages don't just affect the workers, they directly impact the quality of care patients receive. When there aren't enough doctors, nurses, or support staff, patient safety becomes compromised. We see higher patient mortality rates, increased overall healthcare costs, and a greater psychological strain on the staff who remain. Reduced public sector capacity also means less provider to patient time. That leads to delays in diagnosis, delays in treatments, and a higher likelihood of medical errors. Staffing shortages create a cycle that weaken the entire healthcare system, making it harder for patients to receive timely and effective care. Here I have a quote from an article titled, "Why Are Healthcare Providers Leaving Their Jobs?" They say, critically, staffing shortages are associated with compromised patient safety, increased patient mortality, increased cost, and elevated psychological burden on remaining staff. Below, I have a graph from Time Study that shows the projection of vacant healthcare jobs by the year 2036. Privatization would introduce a two-tier healthcare system in Canada, one that divides people based on their income. Private care depends on out-of-pocket payments, and the reality is that most Canadians simply can't afford those costs. That means people who can't pay risk having their conditions worsen as they wait longer for care. This kind of system creates a clear divide. The private sector would primarily benefit wealthier individuals, giving them access to faster treatment and the ability to essentially skip the line. Meanwhile, everyone who relies on the public system would face longer wait times and reduced access because resources and staff would be pulled into the private sector. Queue jumping in a privatized system goes against the core principles of universal healthcare, as it undermines the fairness and contributes to deeper social inequity. When one group consistently receives better or faster treatment simply because they can afford it, the system stops being equitable. That's why strengthening the public system is so important. Instead of creating a two-tier model, we need to invest in the universal system we already have. Here I have a quote from Ontario Health Coalition that says, "It is a system for the rich. It widens the gap between the 1% and the 99%. People who can afford to pay the jump to queue, even when they have less or no need and are buying unnecessary care, pushing back others with greater need." With the introduction of more private sector healthcare, Canadians would likely experience even longer wait times than they already do. Right now, people often wait weeks just to see family doctors and months to access specialists. When private clinics open, they tend to attract doctors, nurses, and specialists with better pay and lighter workloads. But every worker who moves to the private sector is one less provider available in the public system. This adds even more to the staff shortages and directly increases wait times for the majority of Canadians. Longer wait times also means more undiagnosed and untreated conditions, and while for-profit clinics offer convenience for some, they ultimately reduce the number of hours and resources available to the public system. One of the strengths of the Canadian healthcare system is its single payer model. The public system is not only more equitable, but it's also far cheaper and more efficient. Because everything is streamlined under one payer, administrative overhead is kept low, allowing more of the funding to go directly towards patient care. In contrast, multi-payer or privatized systems come with much higher administrative costs. More billing departments, more paperwork, and more financial complexity means more money is spent on running the system rather than delivering care. These systems also offer less equity and weaker risk pooling, which makes healthcare less fair and more financially unstable for many people. Privatization also creates additional financial pressure on patients. Out-of-pocket costs increase, and many operations or treatments fall outside what private clinics offer, forcing people to pay more or return to an already strained public system. I have here a quote from the Canadian Union of Public Employees that says, "Wait times for many medical services are far too long, but studies show that for-profit clinics make things worse. They pull medical staff away from the public system, decrease the hours of service, and make wait lists even longer." I also have a graph that visualizes the wait times have nearly doubled since 1993. Privatization will not solve Canada's current healthcare crisis. In fact, the evidence shows that it would likely make the situation worse, deepening resource shortages, lengthening wait times, and widening the social divide by creating a two-tier system where income determines access to care. Instead, the path forward is strengthening the universal public system we already have. Protecting equity and access means ensuring that every Canadian, regardless of their financial situation, can receive timely, high-quality care. To achieve that, government investments need to focus on supporting the public sector, improving working conditions, expanding resources, and giving medical professionals real incentive to stay and build their careers with the public system. By reinforcing our universal model rather than replacing it, we can work towards a healthcare system that is fair, efficient, and capable of meeting the needs of all Canadians. Thank you so much for listening to my presentation. Here's a list of my references. Have a good day.